everyone, and welcome back to the Smile Project Podcast, the podcast of the School of Dentistry, IMU. Thank you for joining us today. This section of the Smile Project is called the Dental Bites. Tune in to this section for bite-sized learning on the go. So let's begin. Hi, I'm Shahid, your host for today's episode, and I'm here today with Dr. Naveen, who is an oral maxillofacial surgeon in the School of Dentistry of IMU. So as we know, extractions are some of the most common procedures done in dental clinics. So can you please share with us some of the post-extraction instructions that you give to patients, as it is very important that we follow these?
Yeah, hi Shahid and hi everyone. The extractions, as you mentioned, are the most common procedures. And the thing with extractions is that they are also an invasive procedure. So it's very important for everybody who has extractions to follow the instructions to the T. So for my patients, to make the post-extraction instructions easier for them to remember, I always follow the sequence of events to follow. Like the first thing after extraction, when I'm discharging them, I will tell them is to bite on the gauze which is in their mouth for at least a minimum of 30 minutes to 60 minutes. After biting on the gauze for 30 to 60 minutes, they can actually remove the gauze and do the other things.
So what happens if the bleeding doesn't stop after biting on the gauze?
Normally for extraction, which is not difficult, or if the patient is not medically compromised, the bleeding should stop in 30 minutes. If it does continue in some cases, we always give the patient some gauze to take home, so they can roll the gauze and bite over it again for about 15 to 30 minutes. So after this time, what they can do is take the gauze out and eat something and take the medications prescribed. Normally what we do is prescribe some painkillers for normal extractions. So the patient has to obviously eat something before he takes the medications.
What do you recommend that these patients should eat?
Yeah, that's a great question, and that's what all patients ask. So normally what we tell the patient is to avoid anything which is hot, spicy and hard. Basically anything which is not going to harm the patient, harm the wound, or cause discomfort to the patient. Basically something which is like rice or porridge, lots of milkshakes or juice, something around those lines. So once the patient eats that, they can take the painkiller, because the anesthesia which you gave might probably be wearing off. So if they take the painkiller, then it avoids the patient having pain after the extraction. The other important thing we also tell the patient is about how to keep the mouth clean, or the oral hygiene instructions. Surprisingly, we ask the patient not to brush on that day. That's because the socket where the tooth has been extracted normally has a clot. So the patient brushes and he's not careful, they might actually dislodge the clot, which might lead to other complications. So don't brush on that day. We also ask them to avoid mouth rinsing with chlorhexidine mouthwash. They can just use lukewarm water with some salt if they need it. And after every meal, we do advise them to just take water, rinse gently. Meaning they take water, rinse, and then when they spit out passively. So when can they start brushing is maybe after the first day. They brush around the other areas, but be very gentle in that area. So that's about the oral hygiene instructions.
Is there anything else the patient should avoid?
The other things which the patient has to certainly avoid is if he's a smoker or if he's somebody who drinks alcohol, we ask them to avoid these two for at least a week. So we say that they shouldn't be smoking or drinking for at least a week. Other than that, many of the patients these days are into physical activity like going to the gym, swimming and playing sport. So any strenuous activity also needs to be avoided for a couple of days or maybe 3 days until the discomfort is gone. So these are the main instructions that the patient needs to follow, and all these instructions are to make sure that the area of the extraction is kept clean, and also to make sure that they're gentle with how they clean that area. And it's also important for patients to take good rest and also follow the instructions given by the surgeon or the dentist about the medications to be taken.
Okay, thank you so much, Dr. Naveen, for the very helpful information. And thank you all for listening to today's episode. And we hope that this is helpful for anyone who's getting their tooth extracted. Thank you. And remember to tune in to the next episode of the Dental Bites.